All right.
Do you have a steak like to borrow?
Yeah. So we're going to cover the body. We got a few just introductory things to talk about before we get into what we're going to be covering this week, which is the skeletal system. So there's a bunch of human body systems. You know, in different, you could talk about them in different ways. You know, sometimes we say that there's 11, or you may have a slightly different number, because sometimes they get combined, like the skeletal muscular system is often combined into one system. But, you know, for our purposes, what we're going to say is that there are 11 human body systems. Okay? Some of them are shown there. And we're not really going to spend much time talking about this first one, the integumentary system. So the integumentary system is made up of our skin, hair, nails, basically like the outer covering of our body. It is important. What's the purpose like of our skin, for example? Raise your hand if you could tell me. Destiny?
The protection of the inside organs.
Yeah, so it protects our internal organs from what?
Like getting
Damage.
bad,
Damage.
like bad stuff in them?
Yeah, things like pathogens, bacteria, viruses. Our skin sort of is a barrier to those things. It also helps keep an important substance in. You know what?
It's our blood.
Well, our blood's in blood vessels, so it's not really blood. Have you?
Water.
Water. That if our skin is waterproof, so it keeps moisture inside of us so that we don't dehydrate very easily. Okay? Those are the parts of our integumentary system. All right, but the other systems we're going to talk about, skeletal system and muscular system first. We'll talk about those two, the nervous system, the endocrine system, circulatory, lymphatic, respiratory, digestive, excretory, and reproductive. Talk about them one at a time. Now, are those the same systems that you guys covered in health?
No.
Or is there
Kind
some
of.
differences?
Like
Did you guys cover
skeleton.
lymphatic?
No.
Like skeleton, muscular.
Yeah, and we don't really, we talked a little bit about the immune system under circulatory, but we didn't sort of separate it out. So that's why I say sometimes you might talk about 11 body systems, sometimes it might be more or less. So the point is, though, that all of these systems inside of our body are all sort of working together to maintain what we call homeostasis. And homeostasis is an important term for you to know. It's one that's used a lot, especially as you move up in other science classes. Talk a lot about homeostasis and how our bodies maintain that. So what exactly does it mean, homeostasis? Can anyone tell me what the definition might be? So our body systems maintain a homeostasis. So what does that mean? Okay? That's a good example, is that our bodies have to be a certain temperature. And we have systems that help keep it at that level. So that's a good example of homeostasis. What it is, it's basically keeping the proper internal environment. And like Ken just mentioned, body temperature is one of those things. We need to have the right amount of oxygen for all of our cells, the right amount of glucose. Okay? So all of these factors about our internal conditions need to be monitored and adjusted constantly. And that's what homeostasis is, keeping those conditions at the right level. Have you?
Oh, never mind.
Good. And so our body systems are constantly monitoring and adjusting for that. Way back in the beginning of the year, in our living things unit, we talked about this, that living things are organized at different levels. If we're talking about a human, what's our body really made of? What's our body made of?
Tissues.
What are tissues made of? Is there? Cells. Cells are sort of the basic unit of life. That's what our bodies are. They're a collection of cells. Now, is every cell in our body identical?
No.
Is a nerve cell the same as a skin cell? No, they look very different, they have different structures, so they're not the same. Cells in our body are unique. Different types of cells have different jobs to do. Okay? And these cells, they work together. So for example, we have one type of cell in our body are muscle cells. And a muscle cell can go from elongated to short. That's what it can do. And sometimes a whole bunch of these cells work together and they form what we call a tissue. A cluster of cells that's working together to perform some job, we call that a tissue. So in our body, your bicep is made of muscle tissue. Your blood is a type of tissue. Your brain is made of nerve tissue. Again, these are groups of cells that have a job to do, and they work together to do that job. And then several types of tissue can work together. Like for example, our heart, most of it is muscle, but it also is made of nerve tissue as well. So the nerve tissue along with the muscle tissue working together to pump blood through our body form our heart, one of our organs. So a bunch of tissues working together to do a job form an organ. And we can name lots of organs in our body: our kidneys, lungs, skin, eyes, okay? Our muscles. These are all organs. Our stomach, our small intestine, our large intestine. And so if we go one level up, our esophagus, stomach, small intestine, large intestine working together form one of our systems. Which system?
Digestive.
Our digestive system. Our stomach, small intestine, those are part of our digestive system. So a bunch of organs work together. And what's the function of our digestive system?
To swallow. Wait, no.
To like remove waste.
No, not so much waste. Yeah, to break down foods. And so a bunch of organs working together to break down foods, they make up our digestive system. And then finally, if you put all of our organ systems together, you have one complete living organism, one person, a human.
On Friday,
I have not, I didn't decide yet.
go to like watching movies.
So these are how living things are organized at various levels, going from the simplest, which is cells, up to the more complex organ systems. So our first organ system to talk about is the skeletal system. What's the purpose of our skeletal system? What does it do?
Like to protect our like heart and all that organs.
So one important thing is to protect organs inside of our body, like Tyler just mentioned, like our heart. That's one role, protection. What's the other? Jasmine?
It holds it up.
Yeah, it gives our body its structure, its shape, allows us to move. Those are both important parts of what our skeletal system does. So, in an adult human, I know you guys had to memorize this. Raise your hand if you could tell me, how many bones are in an adult human? Avery?
206.
206. Why did I have to say in an adult human? Like, why did I have to mention that? Garrett?
Babies have more bones.
Yeah, that newborns actually have more than 206 bones. Well, what happens? They lose them somehow or something? Raise your hand. Hold on. Roman? Yeah, that smaller bones fuse together to form larger bones, and so the number decreases. So if we think about our skeletal system, it's made of our bones, obviously. And bone, a lot of times I think people think it's kind of like non-living. That it's just like this hard thing that's inside of you, like your hair or your skin or something. your hair or your nails that's like there but not quite alive. But it isn't. It's living tissue. Our bones are alive. Our bones have blood vessels to supply them with oxygen. They're living cells. They're hard and very tough because of the calcium compounds that they form, but it is living tissue. Your bone is alive. And now our bones, are they solid all the way through?
No.
No, they're not. What's inside? What's in the center of our bones? Isaiah? Something called marrow. And do you guys know what that marrow does? It has a certain function. Tyler?
Doesn't it like help keep the bones attached?
No, not for the marrow. Avery? No, not the interior bone, Jasmine. Yeah, it's where our blood cells are formed. So this marrow that's inside of our bones, it actually produces red blood cells and white blood cells and platelets, parts of our blood. They're made within the bones. And you can see this marrow. If you ever take a treat and chicken wings at home, you break one in half.
Bigger what?
There's some stuff inside the middle of the bone, a chicken wing. That's the marrow. You could actually, if you ever get one of those steaks that has a round bone in it, the center of that bone, it's not solid. The center of that bone has marrow in it. You could eat the marrow. It's rich in vitamins. It's rich in fat. It's a good source of animals. Big animals, predators will, if they can break the bones, will eat the marrow out of them because it's rich in nutrients. And people can serve marrow. They can take it out of bones and people eat it. But that marrow is important. It's important for making blood cells.
Why does the blood get out of the bones?
Because there's blood vessels that can take it around. So, those blood vessels are important for that. So then, besides our bones, obviously that's part of our skeletal system, but there's some other parts that we call connective tissue. And this connective tissue connects different parts of our skeletal system or muscular system together. One important part are the ligaments. Right? And so ligaments, you guys know what they do? What they connect?
The time.
Isaiah? What's that? Yeah, they connect bones together. So our bones aren't kind of each separate, just sort of floating there in our body. They're connected together to form our skeleton. And it's ligaments that connect them together. We take, for example, what part of a body is this showing?
The knee.
Yeah, this is the knee. It's the kneecap, the femur, tibia, fibula. These white areas here, this stuff that's sort of stretched between those bones, that's showing the ligaments. Okay? That this is a ligament. And inside of this knee, you see another ligament. Now this one that you see here, it's kind of crisscrossing. It's actually within the knee. And that's probably the one ligament that I would guess you've heard of. So if I asked you to name a ligament, could anyone name one? If I give you a hint, you probably can.
What?
No?
What?
You probably have heard about it if you follow sports. Because a common sports injury of the knee is what? What can you damage or tear inside of a knee?
Numbers, right?
Roman? ACL. So have you ever heard about somebody tore their ACL?
Nope.
It stands for anterior cruciate ligament. It's this ligament inside here. It's a ligament that helps stabilize your knee. It crisscrosses from your femur to your tibia, and it helps give your knee stability. And in sports that involve a lot of cutting and planting, you could sometimes damage your ACL. If you have your foot planted, you get hit from the side of your leg a certain way, it can tear that ACL. And if it's completely torn, then you have to have surgery. They use another piece of tissue from another part of your body to try and recreate your ACL. But it's a long surgery. It takes a long time to recover from. It takes 6 months to a year to fully get back to where you were after you damaged that ACL. But that's a ligament inside of there. There's lots of other ligaments. You've heard, if you're a baseball player, have you ever heard of Tommy John surgery?
Yeah.
Where is that? They have to do surgery in your elbow. who usually is affected? Pitchers. Because of the torque they put on their elbow, throwing curveballs, for example, is that they can damage ligaments in their elbow, and that type of surgery helps to try to repair that. So ligaments help stabilize our joints. They help keep your shoulder joint working properly and help keep everything stable. They're very important in how our bodies work, how our joints move. So ligaments connect the bones together. Tendons, on the other hand, what do tendons do, Tyler?
Like muscles?
Yeah, they are how our muscles connect to our bones. Our muscles' job is to move our bones. When our muscles contract, they pull on our bones. And the way they connect to our bones are through these types of connective tissue called tendons. And they're what actually move our bones. So here, what part of the body are we looking at here?
Oh, your, what's it called, your tri? Is that
What?
like your tri?
No?
Your
This is your
wrist.
leg. That's a person's foot. We're looking at the back view. What muscle is this?
Your gas?
Femur calf.
No, that's a calf muscle.
Oh yeah.
What does
No.
your calf muscle do? When your calf muscle contracts, what does that do?
Help to run?
Yeah, but what exactly does it do? Yeah, it points your toe down. So if you point your toe down, and if you feel your calf at the back of your foot, you can feel that your calf is contracted, it's tight, because you're pointing your toe down. What happens is your calf shortens, it pulls on a tendon that's attached to the back of your heel. What's the name of that tendon? The name of that tendon that's attached to your heel? It's the only one you could probably name. Your Achilles tendon. So at the back of your foot, like just above your shoe, if you have like low shoes on, if you feel that thing in the back of your heel, that's not a bone. A lot of times people think it's a bone because it's really tough and strong, but that's not bone. Okay? That's actually a tendon. That's your Achilles tendon. So your calf muscle attaches to your Achilles tendon, which attaches to the bone in the very back of your heel. And so when your calf pulls on it, it pulls on that tendon and points your toe down. So tendons connect our muscle to our bone to allow our bones to move. Tyler?
Can I go to the bathroom?
No, you don't.
Emergency?
You ruptured a tendon in your foot? Yeah, it's painful, right? All right, and then finally,
Another one.
the last type of connective tissue that we'll talk about is cartilage. What does cartilage do,
It
guys?
protects your heart, like where you're, it's the muscle inside your.
No, I think you're thinking cardiac, maybe.
Oh.
Cardiac muscle?
This is cartilage.
Oh, I know what it is.
Hold on. It doesn't connect really.
Isn't it like that? Like
Oh, I got
stuff
it. God, I got
in
this.
between a bone that's like on your spine that like helps you like
That's what I was thinking of.
Yeah. So cartilage is between where two bones meet, and the end of each bone is covered in cartilage. It's sort of this real slippery substance
That stuff.
that allows the bones to kind of glide over each other. You know, bone is kind of a little bit rough. So if for your knee to move, for your femur and tibia, if they were just bones on top of each other, it'd be very rough and painful to move. But they're not. They're covered in this slippery cartilage, which allows them to glide across each other. It also helps cushion them, so that every time you take a step, your femur is not smashing into your tibia. There's a layer of cartilage there that absorbs that. If we look, so a couple examples. These are vertebrae, right? Your backbone. And this stuff that's between each one, this is cartilage. If you've ever heard of a relative or somebody has a herniated disc or a bulging disc, that's these discs of cartilage. Now they're between each vertebrae so that every time you step, they kind of cushion and absorb the shock. And as you move your spine, they glide over that cartilage. Sometimes they get damaged. Sometimes it could be bone on bone. Sometimes they bulge out and they press on nerves, which causes pain. But those cartilages, those discs and cartilage are important. Jasmine?
If the cartilage wears off, doesn't it cause like arthritis?
Yeah, it can lead to arthritis long term. One second. So what I did to my knee, so that if this is a knee joint, obviously, so this is the end of the femur, this is the top of the tibia. This stuff in here, this is the cartilage, okay? This is the meniscus. That's the cartilage in your knee, and it helps cushion. So every time you step, your femur is cushioned by this layer of cartilage. So I tore a piece of this is called the medial meniscus on the inside of my knee, and I tore some of that somehow, and so now it's painful, and when I walk or run on it or do stuff like that, because some of that cushioning's gone, or there's a little flap of it interfering with how my knee's working right now. So for right now, I'm just going to physical therapy, and then I'm going to get an MRI in a couple weeks, and the doctor will look at, okay, where is the tear? Should we do surgery and cut off the tear? Can we sew it back together? And they can figure that stuff out. So that cartilage is important, and if you damage it, then you'll be in bad shape like me. What was it? You had something, Roman, and Isaiah?
What would happen like if the cartilage like eventually came out?
If it completely wears away totally, then it's very painful. Then you have no cushioning, and so you have like bone on bone, and that ends up leading to arthritis. That the bone tissue builds up and gets inflamed. It's painful.
Okay.
You could have like a knee replacement or something like that done. Sometimes if it gets that bad, where they actually give you a new knee joint or a new shoulder or hip joint. Isaiah, you had something to do?
Yeah. Like, how could the cartilage stuff like come out?
You mean how does it tear and stuff?
Yeah.
It's just like as you get older, like me, some of the flexibility in that cartilage starts to break down. It just isn't as healthy anymore, and so things that you normally would do that wouldn't damage it, if it's sort of wearing down over time, could end up tearing it.
Oh, I got another
So,
question.
yes.
You know what that stuff's like? Sometimes they have like dissolving stitches.
Yeah. I don't exactly know what it's made of, but just something that just sort of breaks down after a certain period of time. I'm not sure. Tyler?
You know how they have that muscle rub stuff?
I guess.
So like rubs.
Yeah.
How does that work?
It just has like some substance that is like a chemical that warms it up. I don't exactly know how it works. Kind of like, if it's like hot pepper, it like makes your mouth feel hot. Same sort of idea. And sometimes it's even the same sort of thing that they use to make those rubs that make something feel cold or feel warm.
I'm like, could the cartilage like wear off and
You could damage it at a young age, but and there's like two ways. Like sometimes you can have a cartilage in like a meniscus, like I did. Sometimes like you're playing whatever lacrosse and you go and you plant and you try to cut, and for some reason the way everything was aligned, it just tears. That's not what happened to me. I didn't have like a sudden thing that tore it. I just was playing, and then it was sore that night, and then the next day I woke up and I was like, you saw me limping around school. It just kind of happened.
You sure you didn't get like slide back?
Yeah, I'm sure. All right, this will be our last slide for today.
What are you playing, like rugby too?
So, I know you guys had to memorize the bones for health. So hopefully this is going to be easy. So we call some of these things, we have like common names for them. Like we might call this the skull, but the scientific name is the cranium. So we're going to be using the scientific name. So the cranium is the skull. It's actually, like we talked about earlier, it's made of several bones that are actually fused together. So the cranium, what's the purpose of the cranium?
Protect your brain.
Protect your brain. Raise your hand, please. All right, then we have the next bone. These bones here. So you probably would call it your collarbone. The scientific name is the clavicle. These are ones that are commonly injured. My daughter, she broke it last summer. Olivia broke her collarbone last summer because her sister pushed her down playing soccer and she fell and hurt her collarbone. Sometimes people break your collarbone, not even if you have like a direct impact to that bone, but sometimes people when they fall, if they have like their arms and catch themselves out straight and that force, if their arms are locked, can break their collarbone or their clavicle. Is that? No, let's just finish this slide then you can. Avery?
My brother had a snow day and his roommate broke his clavicle.
Oh yeah, yeah, it happens. All right. the sternum, so the breastbone, right in the middle of your chest is a very thick, very hard bone. It's called the sternum. Okay, right down the middle of your chest, right here. And
Protects the heart.
along with the rib cage, what does it do, Tyler?
It protects the heart.
Yeah, it protects the heart and the lungs because they're right behind that sternum. So it's important to have a big, strong barrier there to prevent the heart from being damaged. So you have the sternum and then the ribs. There's 24 ribs form the rib cage. They connect to the sternum on the front and the vertebrae on the back, and they enclose those important organs there. Tyler?
Could you ever be born with like more than the ribs that you're supposed to?
Oh, yeah, sometimes there's like abnormalities in different types, not just the ribs, but all different types of bones. They might not be formed properly. Or there's that
How
is
would you
possible.
know if you got extra skeletons?
I don't know. Do they tell by an X-ray probably? Avia?
Remember some kids like their parents are gonna have twins and they end up having the twin inside of them.
They ended up having what?
Their twin connected to them.
Oh, yeah, we're going to talk about that at the end of our unit.
Wait, what is it?
Conjoined twins.
I like it.
All right, so the arms and the legs, the bones that make up our arms and legs are set up in the same way. There's one bone on top, and then the lower part has two bones. Okay? So in the arm, the upper arm bone is the humerus. Okay, you have one bone in your upper arm. Yep. So like in your bicep and tricep area, that's your humerus. The vertebrae, they make up your spine. So if you feel like right down the middle of your back, you gotta feel like each little bump of these vertebrae. Okay? They protect your spinal cord. Again, they have those discs of cartilage in between them to allow them to glide over each other. Now in the forearm, so in your forearm, you have two bones. You have the ulna and the radius. And you're going to have to know which is which. And this is something often that confuses people.
I know.
So there's one bone. One bone is on sort of your thumb side. So if you hold your hand out and like grab on a little above your wrist and then rotate your hand, you could feel inside of there those two bones. And they twist over each other. They crisscross and you could feel that bone move.
Wait, we're right here.
Yeah. And just rotate your wrist. Leave your elbow the same and just rotate your wrist and you can feel it moving in there.
Not really.
Yeah, you should be.
You're stupid.
So, all
Try
right,
this around.
so the one that's on your pinky side is called the ulna. The bone that's on your thumb side is called the radius. To help you remember, your thumb like moves almost in a complete circle more than any other finger, and a radius is a part of a circle. So the radius is on the thumb side, the ulna is on the pinky side.
No, why do they twist?
Just because that's how your hand can rotate.
Why does it just your wrist move?
What do you mean?
Like, why doesn't just your wrist move instead of like your...
Because the elbow can't move, your elbow joint doesn't move this way, only your wrist, so those bones rotate around there, and so your elbow can stay constant. All right, so we have the pelvis. Pelvis is the hip bones. Your vertebrae connect to the pelvis, okay? It's where your femur is attached, your legs, your hips. And the shape of the pelvis and how the bones connect gives us a center of gravity, which allows us to balance and stand upright easier. We also have several vertebrae at the very end of our spinal column that are fused together. Okay? This is, you might call it the tailbone. Okay? It's called the sacrum. And the sacrum here, you know, this is something like if you fall on your butt can hurt. You could break it and it really hurts. Like my daughter, my oldest daughter, we were sledding one time at the parkway and she wiped out and she fell and she was crying. This is when she was young. And I was like, oh, you're fine, just go up the hill. Well, it turned out she actually broke her tailbone. And I kept making her sled down the hill. So that's kind of
Mean.
That's kind of
Wait, so
I
she
didn't-
broke?
I didn't know that she broke it.
Mom, I tell you what I did.
And the problem is that it doesn't heal that well, and so like it hurts. Like now, sometimes if she's on a long car ride, it still hurts.
Let me tell you something. Once I sat down in the car, and you know those seatbelt things how they stick out? I sat on it and it hurt so bad.
I'm sure it did. All right. So our leg bones, so the femur, is the upper leg bone. Okay, there's one, this is the longest bone in the body. Then you have two bones in the lower part of the leg. You have the tibia, which is in the front, the shin bone, that thick bone you feel like where your shin is, that's the tibia. And next to it is called the fibula. They don't rhyme. People want to give them rhyming words. So it's not fibia and tibia, it's tibia and fibula. And then the kneecap, that little part in front of your knee, that round bone, that's called the patella. So the bones are just a little bit different. It's a mandible. So mandible you learn in health, but we didn't include. And you didn't learn to do sacrum, right? What? No. This is Sherlock Bones. No, that's Mr.
I'm like best friends with that. No, I'm
We saw
not even
Mr.
kidding. I'm
Dave.
like best friends with the
So.